dais and my dear friends. I thought Jayesh Lele was a very close friend. Little did I realize that he's going to give me a very onerous task today to describe Dr. Anil Suchak in a span of few minutes. How do I describe or how do I introduce Dr. Anil Nandalal Suchak, who is a friend, philosopher and guide, to use the cliche, to countless of his friends and chahnewales? Many of them are in the audience today. Is he a doctor? But that's just a word. Is he the medical director of Suchak Hospital? But that's just a designation. Is he the past president and trustee of associations like MMA, IMA Mumbai West or AMC? But that's just a post. Is he a social worker, philanthropist, or a team leader? But these are mere descriptions of a small facet of his personality. Is he a karma yogi who works more than 20 hours a day? Maybe, but I thought he should have been a yogi, but his karma made him a doctor. Is he a passionate, committed, dedicated member of IMA and the myriad other associations he spearheaded? But I thought that's merely second nature. Is he a humane doctor? Just ask his countless patients whose life he has touched and they would vouch for the same. Then who is he? Is he a fundraiser? Is he an organizer? Or a pillar of strength to an association? But these are just mere incomplete descriptions of a man who puts his heart and soul into anything he undertakes. So how do you describe Dr. Anil Nandalal Suchak? A personality more powerful than what can be assessed or described, a trait that defies compartmentalization, an energy that appears boundless. I really sat overnight ruminating on my 30 years of very close association with him, talked to a lot of my friends and his closest friends, spoke to his family, trying to understand how to describe Dr. Anil Suchak, but could not come up with a complete description. And hence I thought, I'm just taking the help of various organizations and associations who have just made a biodata and they are trying to describe Dr. Anil Suchak and his achievements. Some of them are mundane and some of them are esoteric. So Dr. Anil Suchak is an anesthesiologist with special interest in critical care. Today, most of these critical care centers today are predominantly managed by anesthetists. But this man at that stage realized that an anesthetist is ideally suited to be a critical care person. And his interest was legendary. Even at that stage, his sixth sense would tell us that whether this patient is going to survive or not, how aggressive to be with this patient. Even today, it's the same. He's also the medical director of Suchak Hospital, a job that gives him his bread, butter and cake. But mistake not, he's alive not because of that, but because of the oxygen and life energies supplied by such associations and the activities which he undertakes with all his vigor. Be it IMA, be it Malad Medical, be it AMC, the Indian Liver Foundation, the Mumbai Kidney Foundation, the Nutan Vidya Mandir School, the Lakshmi Narayan Temple, the Divine Life Society, you name it. Whenever he is associated with any organization, it becomes almost his life mission. These are associations very close to his heart, and he has served them with undiminished passion and commitment. Most of these associations he has worked his way up from a simple, humble worker to rise and become the president and sometimes a trustee of the organizations. Not only he raising, but even the association goes up to dizzying heights with his unmatched determination and trademark enthusiasm, which we all see. As far as I am concerned, all of us are familiar with what he has done for the association. Initially, he was vice president. He was the chairman of the annual scientific conference at Bhaidas Hall. He became then the president of IMA and the trustee of Mumbai West. And of course, he was the joint secretary of Maharashtra State. Similar is the story of Malad Medical Association and Association of Medical Consultants, where again he rose to the height of becoming the president and the managing trustee, who has got almost three lifetime achievement awards. He got it for Malad Medical Association, for Association of Medical Consultants, and today is getting an award which is almost at par with similar one. Let's switch gears from what he has done for the associations and acknowledge Dr. Anil Suchak as a born fighter. He fought death twice and won. We remember 2007 when he was diagnosed as end-stage liver disease.